Hello everybody. Welcome to the Golden Jubilee celebration of the RSSDI, which is the Research Society for the Study of Diabetes in India. I am Dr. Rucha Mehta, a practicing endocrinologist and diabetologist at Edmo Clinic and Apollo Hospitals in Ahmedabad, and it gives me great pleasure to discuss my topic today. So today in the morning, we were very glad to start off the sessions with a great discussion on all the parameters or all the research that is ongoing in India. My colleague Dr. R.M. Anjana presented data from the ICMR India DIAB study, which is an ongoing study about the prevalence of diabetes in India, pre-diabetes and all the risk factors that lead to this growing burden of diabetes in India. This was followed by a talk by Dr. Sujoy Ghosh from Kolkata, and Dr. Sujoy Ghosh nicely spoke about the pancreatic sources of diabetes and specifically an entity known as FCPD. My task was new and very relevant. What I spoke about was this growing obesity and diabetes paradox in India. So what is this obesity-diabetes paradox and how is this relevant to all of us, not just as clinicians but also as patients and as Indians? What we have been finding in the last several years that India has risen to the top on the global world map with the highest number of obesity and also with diabetes. Now what we also know that the cutoff values generally whereby we define obesity is a simple term known as BMI or body mass index. For the Caucasian and other parts of the world, the BMI cutoff for obesity is higher than 30 kilograms per meter square. However, for Asian Indians such as ourselves, that cutoff is set much lower at 25 kg per meter square. Now, this behooves us to think why so. What we know is that Indians get diabetes, heart disease, strokes, dyslipidemia and high blood pressure at a much lower BMI. Now, this has led us all to kind of understand what is going on. Why are Indians compared to European, Caucasian and African American counterparts getting diabetes not only at lower BMI but also at a younger age? Dr. Yagnik in his paper has suggested something known as the thrifty phenotype, and he talks about the thin fat Indian, and also he has coined the term known as the thin fat neonatal baby. So not only as Indians do we have a much lower BMI. So at a normal BMI, we have a high body fat percentage, and this body fat, especially visceral fat, leads us to develop diabetes at a younger age. He points that this may start off as early as when we are in the intrauterine environment, and maternal malnutrition seems to lead the baby to have a thrifty phenotype wherein the baby's energy levels are diverted to the brain. This leads to fat development in the visceral and the abdominal areas, and right from birth we are at a high risk for diabetes and cardiovascular disease. So, couple of things to think about. How can we detect these patients in clinic? If they look normal to you, they have normal BMI, how will you know they have central fat? The easiest measures for you as clinicians are waist circumference, waist to hip ratio, and the latest is a waist to height ratio, and this should be less than 50% or 0.5. Secondly, you must measure this each time. Thirdly, once you suspect these patients have any of the above, you need to screen them for diabetes and act upon trying to work to reduce this body fat and preventing future complications. Therefore, in the future, we will see a much different approach to the way we manage diabetes. We must understand the thin fat Indian. We must understand that the origin lies right at the level of the maternal malnutrition and the intrauterine environment. And I would request all of you, the government, and this is a huge public health responsibility, that we start working at the grassroots level at the time when we are still in the womb and improve maternal nutrition. Then on we go on to improve child and adolescent nutrition, and as clinicians try to recognize these thin fat Indians, or we will miss almost 30% of patients with type 2 diabetes. I thank you very much for your attention, and again I request you to enjoy the sessions.